Welcome to part 2 of the series on physician documentation in Meditech Expanse. We will cover what are typicals, applying typicals to your reports, and creating and managing typicals. So, what are typicals? Typicals are an innovative way to improve your documentation efficiency by allowing you to fill in parts of a document with your usual findings using minimal clicks. This feature is similar to the normals functionality you may have previously used for documentation. The difference between typicals and normals are that each user will be able to create a unique pattern for their typical findings that are customizable on an individual basis. Applying a typical to your document is a fluent process. Using the documentation header button, just select the document you wish to create, and then click this icon to see a list of your saved typicals. Choose from your list of saved typicals, then apply. The documentation you saved will populate into your template. Saved typicals are specific to each document type, such as history and physicals, progress notes, discharge summaries, and so forth. Creating typicals is a natural process that should integrate seamlessly into your workflow. To create a new typical, begin your documentation process as you normally would. For this example, let's use a draft H&P. In this instance, we have already recalled all available documentation. I have went in and filled in the parts of the documentation with phrases and findings consistent with a patient presenting with chest pain. As previously shown, this will serve as an underscore for the data to be filled in later. Pro tip: when creating typicals, be sure to complete these sections with enough documentation to meet your expected level of care for coding. When you are happy with the documentation, select the gear icon and choose Create New Typical. In this overlay, you can further customize your typical by unchecking specific items. Alert: when creating or editing your typicals, take extra care to remove any patient-specific dictations, comments, and past medical history data. This will prevent erroneous documentation when applying a saved typical to a new document on different patients. Let's remove the patient-specific information for past medical history, so this data does not carry over when using this typical. When naming your typicals, it is recommended that you put your document type in the title. For this typical, let's name it H&P chest pain, and then click Save. This typical will now be available for use on all of your H&P templates. You can edit and manage your existing typicals at any time within Expanse. Select the menu icon from the static header bar in your browser and choose Manage Typicals. In this screen, you can rename your typicals, delete existing typicals, and edit specific items for each section within a template, as seen here. We hope you enjoyed this video on Meditech Expanse. If you have any questions, please see our other videos or contact physician support. Thank you.